If I were to ask, what comes to mind when I say the word bat? Most of us would say Batman or vampires. There could be a whole lot of other words that can be associated with the word bat, but how many of us thought of Ebola? Not many of us know that the only known origin of the Ebola virus is said to be fruit bat. According to the World Health Organization, Ebola first appeared in 1976 in Sudan and in a village near the Ebola River in the Democratic Republic of Congo, hence the name Ebola. Now, years later, the virus has reappeared, and not many of us know what the symptoms are, how you can get infected, and obviously how it can be prevented. Now let's look at the transmission of Ebola. Ebola can either be transmitted through animals or through to human-human contact. Now let's look at the transmission in animals. Although the fruit bat is the only known origin of the Ebola virus, other animals can also get infected with the virus and carry the virus. The virus can be spread into the human population through contact with blood, secretion, bodily fluids, or organs of an infected animal, for instance, chimpanzees or monkeys. And the human-to-human transmission? Human transmission can also spread through the contact of the blood, secretion, organs, or bodily fluid of an infected patient. In healthcare, a lot of healthcare workers get infected with the Ebola virus when handling patients that are infected with the Ebola virus because they are not wearing protective gear. And when a person dies of the Ebola virus, if you come into contact with the body, you can still get infected because even though the person is dead, the Ebola virus is still alive. What are some of the symptoms of Ebola? The first symptoms a person can notice when they have the Ebola virus would be onset fever and fatigue, muscle pain, as well as headache and throat. The following symptoms would also appear after the first symptoms. You can start vomiting, diarrhea, rash, impaired liver and kidney function, as well as internal and external bleeding. For instance, you could have bleeding gums or bleeding in your stool. How can you prevent Ebola? We can reduce Ebola by reducing animal to human transmission. For instance, animals that are infected with Ebola should be handled with care, and people handling the animals should always wear protective gear. All meat should be thoroughly cooked before eating. And how do we reduce human-to-human transmission? Washing hands regularly after visiting a hospital or a patient who's got Ebola. And always wearing protective gear when dealing or handling somebody who's infected with the Ebola virus. And separating the healthy people from the people that are infected with the Ebola virus, for instance, quarantine. Hygiene and maintaining a clean household environment is also a very good way to prevent Ebola. In conclusion, now that we have heard what causes Ebola, how you can get infected, and what the symptoms are and how you can prevent from being infected, it is our duty to make others aware of how deadly the virus is and give them a fighting chance. Thank you.